Now I want to demonstrate the sensitivity aspects of the Revell ventilator and how that kind of plays into our patients. The first thing to know is the Revell ventilator has what's called a bias flow of 5 liters per minute, and that was an improvement on the LTV 1200. At 5 liters per minute, it doesn't use as much gas, and so essentially what that is the amount of gas going through the circuit in a big circle during exhalation, and it's used for a flow trigger. So your Revell ventilator and your LTV 1200 are flow-triggered ventilators. So right now I have this set at a 4, and so what that means is the bias flow is utilizing 4 liters per minute for that flow trigger, or I should say the trigger is utilizing 4 liters a minute of that bias flow. If we come over here to my little board here, you can see that 4 liters per minute is equal to 4,000 mils in 60 seconds. So all I did here is I just reduced those two downs to the simplest form. So 4 liters is 4,000 mils, 1 minute is 60 seconds. And if we divide 60 into 4,000, we get 67 mils a second. So all we have to do in a flow-triggered ventilator is we have to essentially move the flow. That's all the patient has to do is exert 67 mils a second of exertion to trigger a breath, whether you're in assist control or SIMV. So why is that important? If I turn this down just to demonstrate how easy it is to trigger this ventilator, and I want you to look at this patient effort, and all I'm going to do is I'm just wiggling this vent circuit. And you can see that our respiratory rate is set at 12, but if I turn this to our frequency, which is the total amount of breaths given, and if you watch this, it's going to shoot up, right? So I'm simply just vibrating this circuit. And that's kind of a bad flaw in a flow-triggered ventilator is the how easy it is to cause auto-triggering. That's one of the reasons why we kind of push SIMV. It's not that SIMV is a more superior mode. Really, when you look at the literature, assist control versus SIMV versus PRVC, there was no difference in outcomes in morbidity and mortality among the 3 modes. I think each one of them gives you a different functionality, and I think the SIMV in the transport environment is just much better because of this event right here. So we recommend that you start with a flow trigger of at least 4. And what, again, that gives you that 4 liters per minute. We reduce that down from 4 liters a minute to 4,000 mils in 60 seconds, and that gives you 67 mils per second. If we raised that up and we went to 5,000 mils, or I should say a trigger of 5, we would have to do something different with a Revell ventilator. Again, the Revell ventilator, if I hit select here, and I scroll over to vent config, and I scroll over to bias flow, hit select there, we're at a 5 liter per minute bias flow. You can actually turn this up to 10. And again, that's one of the features of the Revell. It still has the same functionality. And you'll see if I hit select here and I go out, now I can actually turn my sensitivity up more. If it's set at 5 liters per minute, the max sensitivity you can actually increase that to is 4. The other aspect that this ventilator has that other ventilators like the LTV 1200 does not is it allows you to turn this to a pressure trigger on the fly. So if you're having an auto-triggering event, you just can't get it to stop, what I want you to do is hit this select button on sensitivity, scope counterclockwise to P, and hit select. And so we have now a pressure trigger. It's default set in the back of the ventilator at -3. So instead of actually diverting the flow 67 mils per second with a sensitivity of 4, now we have a -3 centimeters of water that's at the end of the vent circuit, and that's what the patient has to exert is 3 centimeters of water to bring that to 0 to trigger the ventilator, whether you're in assist control or SIMV. And that is the big part of the Revell ventilator and sensitivity.